This morning, it's a bit overcast here in Scarborough, but as we kickstart the morning, we want to start off by reminding our viewers that from tonight, the Christmas Village kicks off at the Scarborough Esplanade. So you can come down to Scarborough this evening and enjoy all that's happening at the Scarborough Esplanade with your entire family. This morning, I have the privilege of having a quite engaging conversation with Dr. Denise Tsoiafatt-Angus, who is the political leader of the IDA. Good morning, Dr. Angus, and welcome.
Good morning, Shenell, and good morning to all of your viewing and listening audience out there.
Right. I mean, there is so much to talk about. So much has been happening, and it's been a while since we've been able to really sit down and chat. But before we even get into anything, we want to be sure to send special condolences out to the family of the Minister in the Ministry of Education, MP Lisa Morris Julian, and her entire family.
Yes, certainly condolences must be extended. And, you know, when you look at who she was, excuse me, she was the epitome of service. Service to the people, service to family. And, you know, that's the way she died. You know, I understood that she went back in to save her children. And if nothing else, to be with them. And, you know, it just speaks to who she was. And so she's left an indelible mark on the Trinidad and Tobago. Yes, because there are many people here who would have interacted with her. And she will be missed. May her soul rest in peace. And I'm also wondering why a book, condolences book, has not been laid at the Assembly Legislature in Tobago so that people who are here who would like to extend condolences can go and do that there and not have to make the trip to Trinidad.
Excellent. Well, thank you for that contribution. Now, a lot has been happening where senior citizens are concerned and senior citizens pension. A lot of persons may not know that there are new proposals for the senior citizens bills, for the senior citizen bill. Can you tell us about that? What is being proposed for those who do not know, and why it is important to pay attention to this?
Okay, so before we go there, I know that we had some interviews with the former youth debaters. And let me say, as a former presiding officer and as a leader on this island, my heart is full. I feel assured that we are going to be having Tobago in good hands in the future. And I congratulate them for their stellar work on that debate in the House last week. And it will be interesting to hear what they would say about this senior citizens issue. The biggest part that is being discussed in the public domain concerning the senior citizens legislature that they intend to take to Parliament is the fact that they would like to ensure that if you are a senior citizen and you have $25,000 in the bank, you have nothing to get from this government. No matter how hard you worked in the past to contribute to the development of this country, they are saying to you, we don't value you. Your work didn't matter. And so we're not, if you have $25,000 in the bank, you know.
Yeah, but when we look at the grand scheme of things and the cost of living in Trinidad and Tobago, $25,000 can barely make a dent in a year.
Exactly.
So,
and what you see, the challenge is this government is not being honest with the people. The economy is crashing. And they are bankrupt of ideas as to how to keep it going. And they're waiting on the 2027 oil deal to come through, which we don't know where that is now with the change in government in the US. And so what they're doing is really laying it on the people. So you're seeing the taxes coming back, the property tax, and now this, where $25,000 you get nothing. And it really is not fair. It is not appropriate, and it will be their downfall, because whilst you're saying on one hand, if you have $25,000, we are not giving you anything. On the other hand, you're saying, well, I work hard for the money as a prime minister and a parliamentarian, so give us our increases, and everybody else can go where.
Exactly. I mean, when we look at the economy and where Trinidad and Tobago is going, and a lot of persons came out and said in response to that SRC report on the increase for public officials that now is not the time for something like that. So how can on one end you're saying, okay, public officials deserve this increase now, and then on the other hand, you're saying that senior citizens, because they have had a life savings, cannot benefit from their pension scheme, but then you're trying to secure the pension of politicians.
Yeah.
Where do we find the middle ground?
And that's a good question. The middle ground is found in a compassionate government. A compassionate government who cares about their people. And what we are experiencing now is a government that does not care. They demonstrate that over and over. They don't care. They've been there for 10 years. And they're like, well, we taking what we taking right now, and is all it a catch when we gone. And that is the feeling that you're getting coming out of them. Because when you look at all of the areas where our people are being taxed in terms of, not having access to things, bringing back property tax, all of these areas, it will land differently if people saw that while you're doing all these things, you, the leaders who are making those decisions for us, are also making a sacrifice. And I think nobody's saying that maybe the salaries are low in the country. Nobody's saying that they should not be increased. But the challenge is you can't be increasing it at the expense of taxing and frustrating the rest of the people to pay for your increases.
Right. And for the persons who are not yet very close to retirement age, when we look at what is happening, is it wise for them to start seeking out alternative pension mechanisms, whether it be through insurance companies and private pension schemes in the credit unions? Because we're seeing a situation where you cannot hinge your last days on what this government decides to do or not to do.
Absolutely. I mean, if your back is against the wall, you have to see and you have to look down the road. How do you protect yourself and your family to ensure that down the road, when you no longer have a job, that you all can still see yourselves as making it? And yes, all those are ways that people can explore in terms of securing their future. And this is where, I like what you said, the credit unions have a big part to play, especially in the Tobago space where you are, embedded in communities. The credit unions have a big part to play.
Right. And you have a lot of persons when they look at investments, you don't always hear persons talking about creating a retirement plan here in Tobago, particularly. Maybe in the US or in some of the first world countries, you hear persons prioritizing a retirement plan. But when it comes to setting apart a retirement plan and not knowing exactly what the future of Trinidad and Tobago's economy is, and as you indicated, hinging it on what might or could happen, puts a lot of persons at risk. So does the government also have a duty if it's now saying, okay, because we may be facing somewhat of an economic crisis in the future, let us educate the public on alternative ways of preparing for the future?
But like I said, if you have a compassionate and caring government, you will first of all share with the people, the realities that we are looking at, and you ask them to come on board and partner with you to explore the alternatives. Yes, I would expect that, they would perhaps call the people together, see all of the areas that they can explore, that they can send their people to explore, and ask them to, and share that information with them.
Right. But we know that from time to time when the government makes major financial decisions for the country, it's not always under their own volition, but sometimes it's based on the advice of the international agencies that we have borrowed from in order for us to maintain a particular global standing. So could it be that this has been a part of a recommendation to us in order for us to maintain international funding?
Was it also a recommendation to accept the SRC report?
That's a good question that you raised there. But it also speaks to a level of elitism that persons are struggling with when we look at Trinidad and Tobago and how the rich continues to get richer while the poor is getting poorer, and that gap between the rich and poor begins to widen more and more. And you're seeing a situation where leaders are prioritizing their own pockets as opposed to prioritizing the overall development of a country. And this is a quite peculiar thing because we have an election coming up very soon. And you would think that the leaders that are there now who strive to be re-elected would make decisions for the whole as opposed to making decisions for themselves. But then there's the other side of the coin where you hear persons arguing that if they know that they might not be going back there, they are securing themselves for their future. How do you feel about it when you look at that situation?
We have challenges. The challenge is not just in Trinidad, it's also in Tobago. And it is what politicians feel the culture of politics should be. You do whatever you want. We're talking about Trinidad and also in Tobago. Do whatever you want for the 3, 4, 5 years. And then when you come to elections, we just go and flood the market with money, and we know you will put us back there. Okay? That is the culture of elections and politicians in the country and in Tobago. We feel that you could do, like I said, do whatever you want for while you're there. And then in the last year, 6 months, you flood the market with money and with things, goodies, and then you expect people to put you back there. That formula can no longer work. It is a dangerous formula because Trinidad and Tobago no longer has the resources that we had in the past to be able to use money like that, wantonly wasting it.
Right.
And so what you will find is that they will do that, and the people will end up in a bigger crisis where you have more grants like these being taken away from you, more opportunities being taken away from you, and you're being pressured by tax schemes. And the people suffer in the end if you don't put a government in place to ensure that they can see about your future. But it's not just putting a government in place. We have to change the design of our governance structure. Our governance structure allows too much of a dictatorship type approach to policies, development, and even the laws that we have. And therefore, you have to change the government to accommodate bringing the people more into having a say and contributing to development on the island. And until we do that, we will continue to have governments in place who just, doing whatever they want without taking into consideration to the people. And I see they flashing the health sector here. I'm bringing the health sector into this now. The health sector is getting into business that is not their own. It's not part of the health sector. And the administration is operating as if it doesn't understand economics, and it does not understand the economics of a small Tobago economy, which is very fragile at this time. The hospital, they don't have enough medications. All the medications on the formulary for your diabetes, high blood pressure, just about anything you call, you go there, nil, 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 nil. That same person who has $25,000 in the bank, who is not going to receive a pension now, has to take that money and go to a private pharmacy to purchase medications to stay alive on the $25,000. Right? Because what you were supposed to be getting free, remember, you work and pay health surcharge for years to get these medications free at this time. It is no longer in the pharmacy, in the hospital pharmacy. You now have to go and get it from outside. There are no fans, or no, the AC units are not working in our units. The conditions that your health workers and also the patients are under is very poor. You don't have the, diagnostic equipment that may not be working from time to time, and they can't get fixed. But what does the health sector do? They have monies, apparently, put down somewhere, and they have now gone out supposedly to purchase a villa resort to outfit, put in oncology and HIV. That really does not make any sense. That is a wastage of funds. When you consider the scarcity of funds we say we have in Tobago, no money is the song now. You don't use that money that way. The hospital system sits on 27 acres. It was designed for the expansion on site. Why did we not use a portion of that 20 million? It wasn't going to cost you 20 million to put the hospital on site, because remember that 20 million being spent does not include equipment yet. And it does not include the retrofitting of those villas to now be hospital grade to offer services. So we're talking closer to 40 million for that to be established. It would not have taken that to put the oncology unit on site. Yes? Create a purpose-built facility so that you involve the users. It's building from scratch. So you have a facility that can serve the population of Tobago to ensure oncology care is delivered in a seamless way.
Right. And you can also still have the entire wellness function of it, if that is what was trying to be achieved by having somewhat of a villa type environment. You could have built that into
You could have
the
built that
facility.
into the facility on the 27 acres that you have sitting down there.
You could have all the wellness elements.
And all of the wellness elements along with it. Yeah? Because the hospital, like I said, was built for the expansion. But when you're not having strategic planning in the health sector and understanding what are the issues, how do you close the gap while you expand? If you don't have that happening, then you're going to have these poor decisions being made at this time, because that 20 million has to be exported, I understand. Some US has to be gotten. to contribute to that purchase. So it really doesn't augur well for us in Tobago with that. The additional resources you had from that could have been spent on making sure that your chronic disease profiles have their medications. At least patients who are over 60, 65 years old,
And give them
you
priority.
put your own fund in place to ensure that when patients, if they have to go to a pharmacy, you have a conversation with all of the pharmacies. This is what we're willing to
Right.
pay for
And
these
and
bills.
what about the
And
conversation?
therefore you pay for it for your senior citizens.
And what about the conversation surrounding health insurance for a particular age group and ensuring that if there is indeed a financial crisis within the health sector, that just like in certain countries, first world countries, if you have that insurance, you are able to access the medicine, and let's say, for instance, your insurance company would pay
who is paying for the
half.
health insurance?
Well, I'm saying if there can be a stipend or a subsidy attached to persons between a particular age bracket being given health insurance, if there is pressure currently on the health system. Let's say, for instance, if a health insurance package costs $1,000 a month, a subsidy is put in place so that a person individually might only be paying $400 to $500, and that can also ease some of the burden off of the public health system.
Are we aware that we pay health surcharge?
Yeah.
Yeah. So the health surcharge that we have paid for numerous years is supposed to go to the health sector. Yes. But when you have wastage of funds, being done in the health sector, that's when you're going to be in crisis. If those funds are managed well and decisions are made appropriately, okay, the health sector should now be looking at how can we get into medical tourism. If you're doing something to get into medical tourism that then brings back resources into the health sector, then you will not be in a crisis. We have to start looking beyond just what we are given. And we have to start saying, how do we in the health sector invest this money so that we get returns on our investment? Okay? And how do we manage those resources to the best of our ability? Like I said, that 20 million, you still not, you bought something, you still have to spend a lot of money to retrofit them. That was a very poor decision. And, I don't know. They need to be investigated for that.
All right. But we're going to take a quick break right here, and we're going to be back with much more conversation right after this. See you soon.
It's a brand new